Did you know that 94 million men are affected by a disease we call prostate enlargement worldwide? In fact, by age 45, the chances of a man having this disease called prostate enlargement is almost 50%. It stands at 45%. That is just slightly below 50%. And by the time someone is 70 years old, their chances of having this disease is 80%. So that means if you're a man out there and you're 45 years and above, there's a half chance, there's a 50% chance that you're actually suffering from this disease called prostate enlargement. I'm not sure if you've heard about it before, but prostate enlargement brings about an enlargement of a small gland called the prostate. As you can see in this image here, it's part of your urinary system from the kidneys into the bladder and then into the prostate. So this is the prostate. It's a small organ just right down here. So that organ enlarges due to hormonal changes after the age of 40 to cause a disease that we call benign prostatic hyperplasia, which is an enlargement of the prostate. Now, the enlargement of the prostate comes with several symptoms. Now, I want you to listen very carefully to these symptoms to see if you have any one of these symptoms. One, frequency of urination at night. Do you urinate multiple times at night? Do you urinate 3 times, 4 times, 5 times, or even more times at night? Okay? You could be suffering from prostate BPH, prostate enlargement. Symptom number 2 is urgency of urination. At the time when you want to urinate, you have to run very quickly to the toilet. Otherwise, if you find someone in the toilet, you just keep jumping around. You just jump around until that person comes out and then you urinate. And in fact, in severe circumstances, in other circumstances, for example, you're stuck in traffic jam, you find that the urine slips out into your pants. That is what we call incontinence. So that is symptom number 2. Symptom number 3, you can no longer urinate very far. You can no longer compete like you used to compete with John. Do you remember when you were at Chabakade Primary School those days? You could compete. You could even go after classes and you compete who is going to urinate far. But now you can't. You can't urinate far. You have to urinate very close. There is a weak stream of urine, and it even doesn't come at once. It hesitates. It sort of breaks as you urinate. It breaks. Okay? And another of the symptoms is a burning sensation. There's that burning sensation while you're urinating, and that comes when this disease has grown, probably out of a complication like a urinary tract infection that comes, sometimes lower abdominal pain and also back pain. There's also another symptom. There's a reduction in libido. A reduction in libido. Why? Because the prostate that we are talking about is actually a sexual organ. It's a sexual gland. It plays a large part in you being a man. So the enlargement of the prostate brings about a reduction in libido. Prostate BPH. Nagambo why? Nekangende watimo timabada nkwanire emyaka 3 so let me go to Timo. So it reduces that libido. So those are the symptoms of this disease that we are calling benign prostatic hyperplasia or prostate enlargement, which happens in men over the age of 40. Okay? Why? Due to hormonal changes that occur with this disease. Now, the end stages of this disease involve the following. What we would call the complications of this disease. One of them is incontinence. At the final stages, why does that happen? Because the urethra passes through the prostate. And that is the reason why you get all the symptoms I've mentioned. Why? Because the enlargement of the prostate puts pressure on the urethra and therefore urine cannot come out well. Okay? It blocks the prostate, bringing about frequency of urination. Why? Because you can no longer empty the bladder fully at once, so you have to urinate multiple times. Urgency of urination. Okay? Why? Because the urethra itself is affected and the walls of the bladder are also affected. Okay? Which brings about overactivity, bringing about that urgency at the time of urination. Okay? Then another symptom is hesitancy of urination, weak stream of urine. Why? Because there's a blockage. Okay? And that comes with lower abdominal pain, low abdominal pain in some patients. It comes with a burning sensation while urinating. It comes with back pain coming from the complications like UTI. Why? Because your urine is stagnant. So that stagnation brings about the symptoms. But then at the end stage, ng'obulwadde bukuliridde ky'oyinza okuyita kwegamba obulwadde bukomyeyo. Okay, that is where we get incontinence, where omuntu omusolo bwe gujja gumuyita muyisi nga alina kwambala pampa. At any time there is lack of control on urine, and in some patients they completely block in what we call complete bladder obstruction. Ekyo kiba kitegeeza nti okukeera ku makya, you try to go to the toilet to urinate, but urine doesn't come out. Okay, urine doesn't come out. Okay. Why? Because the passage of urine, which is the urethra, is completely blocked. So you can't pass urine out. Imagine you wake up in the morning at 7 a.m. and you're feeling your bladder is full. You go to the toilet. What would be happening? Would just find someone who is crying. Imagine an adult man with children crying tears because of urine. And in those patients, that is an emergency. What we do is we catheterize kutekamu akapiira. Nduseke eno wansi, netukayisa eno. Bwekagaana okuyitayo, we do what we call suprapubic catheter, netuteka wano waggulu wansi mukundi, just above the abdomen. So that is prostate enlargement. So if you're a man and you're over 40 years, take off some time from your workplace. I know you're busy. Okay? Take off some time and go to the nearest facility and check for this disease that we are calling prostate enlargement. This is an existential crisis, okay, which has the capability to destroy the entire fabric of your life. Like I stated earlier, from your marriage because of reduced libido to your social, your social status because urine can just come and pass through. Imagine if you're catheterized, you can't be that hygienic. So go and check before it's too late. At Crest Natural Health Centre, we use the state-of-the-art in technology to check for diseases that affect the prostate, including but not limited to benign prostatic hyperplasia and all diseases that affect the urinary system. We have an array of highly qualified urologists nga bo baakuuka mu kintu kimu kujjanjaba system eno ey'omusulo bulwadde bwonna kwatagana n'omusulo. So our urologists use homeopathic medicine to treat these diseases, and it is one of the most effective ways of treating prostate enlargement. Okay? To learn more about what we do, you can call our numbers on screen, or you can visit our website at www.crestnaturalhealthcenter.com to learn more or even book an appointment. If you'd like to visit our clinic, you can find us at our main branch here in Gayaza, in Rutete, Gayaza Road, opposite Vision Petroleum, 8 miles from the Kampala city center. And for you people, those ends of Masaka, you can find us in Inyendo, opposite Amafuta, BAM petrol station, opposite BAM petrol station in Inyendo. Don't forget to like this video, do not forget to share, and do not forget to follow for more exciting content. My name is Mupara Kwantimba. I'm a medical imaging technologist, a healthcare professional that uses technology to check for different diseases in the human body. Thank you so much for listening. Let me catch you in the next one.